Good morning, everyone. I have right at 9 o'clock, so we'll go ahead and get started today. Welcome to our third session of 5 for the quality infrastructure. We are going to talk about the elements of a culture of continuous improvement through systems and through behaviors today. My name is Jennifer Wagner, and I am the Director of Rural Health Initiatives with Convergence Health, and I'm really excited to be going through this series with you guys. This was a really fun project to be involved in on the federal level, and I think you'll find um, the assessment and the intention of the assessment to be helpful not only to your federal funders, but also in your local hospital. So before we get started, for anyone that's new and hasn't been on the other two sessions, I just want to give a quick level set to what we're doing in this series. On March 23rd, we had national partners for the Rural Hospital Flexibility Program convene a group of cost staff, state flex programs, hospital association staff, and several quality consultants and quality program subcontractors for the sole purpose of identifying what attributes belong to a strong quality infrastructure in critical access hospitals. And I want to give credit to the Federal Office of Rural Health Policy that funds the FLEX program and the FLEX monitoring team, the National Rural Health Resource Center, and Stratus Health. They are the guideposts behind this assessment and this infrastructure and this work, and they have developed a well-formed, informed, and valuable resource, and also a data source for rural hospitals and the programs that support them. From working with these folks, they truly understand rural and care about rural healthcare quality. We do provide links to the report for you to read in its entirety, as the report does deliver detailed information on the quality infrastructure and context to each element and the process as a whole. And while you see CA or critical access noted through the report and assessment, the content is really can apply to any rural hospital quality programs. And in our conversations, we can talk about how our rural hospitals can meet these elements. So today's objectives, we're going to look at the data results from the CA quality infrastructure self-assessment as a nation. And then we're going to talk about the criteria to meet each of these elements. And I want you to be thinking of one thing that if this is an element that your hospital doesn't meet, what is one thing that you can do to get closer to meeting that element? Kind of looking at it as a small test of change and what we can do to improve and grow. So today we'll be talking about the elements in orange, a culture of continuous improvement through systems and behaviors. These go hand in hand and are equally important. And as we go through the elements today, heads up, I'll be encouraging some chat conversation. This is a really good opportunity to ask questions. Me and of your peers on the call that may be meeting some of these elements. So we always want to allow opportunity for peer-to-peer sharing, and we'll have that today as well. As a reminder that these elements and criteria will be naturally nuanced to your state or your hospital. And really what we're intending to do with this series is give that broad overview of the elements and the different ways to meet that criteria. So for each core element, there are 2 to 4 criteria that list ways these elements can be met or demonstrated. And to meet the element, a hospital must meet each of those criteria. And we'll go over the ways these criteria can be met today. So first, we're going to talk through culture of continuous improvement through systems. As you saw on the graph, this is a very high-performing element. I think we have systems in place in many of our organizations, and it's just strengthening those and building those systems into habits and something that continually happens. It's really fantastic to have these systems in place because it does encourage the behaviors that we'll talk about in a little bit. It gives the foundation for completing those behaviors. So there are 3 criteria for culture of continuous improvement through systems. The first is that the organization uses standardized methods for improving processes. The second is leadership incorporates expectations for QI into job descriptions and department and committee charters. And the third is the organization has processes in place for continuous reporting and monitoring of QI data. So each of these individual elements are high scoring, which obviously reflects on the core element being high scoring as well. And these really reflected to those QAPI standards that have been placed for our hospitals, right? Like it's regulation to have some of these pieces in place. So we are doing really great in meeting those regulations, which are, now that we can see, really help build that strong infrastructure. So I want to talk a little bit about just culture. Just culture is really an important foundation to a culture of continuous improvement as a whole. It's the basis of the systems and the behaviors. The definition of just culture, to bring anyone up to date, is a just culture refers to a system of shared accountability in which organizations are accountable for the systems they have designed and for responding to the behaviors of their employees in a fair and just manner. Employees are accountable for the quality of their choices and for reporting errors and system vulnerabilities. So as you can see, this is really important to laying the groundwork for the culture of continuous improvement in both systems and behaviors. So in a just culture, we want to see environmental structures and processes within the healthcare organization. Just culture impacts the perceptions and attitudes of individuals within the healthcare organization. It needs buy-in and support from all levels of the administration, and hinges on the behavior of individuals. So just culture is kind of the baseline, like I said, for our first criteria of this element. And the first criteria is the organization uses standardized methods for improving processes. And there's many methods out there. The most common ones that we see are Plan, Do, Study, Act, and the Model for Improvement, which is from the Institute of Healthcare Improvement, Lean methodology, Six Sigma and DMAIC, and FMEA, or failure mode and effect analysis. And these methods rely on a just culture to be effective. Criteria 2, leadership incorporates expectations for quality improvement into job descriptions and department and committee charters. So I'm curious, in your hospital, which job descriptions and charters incorporate quality improvement? If you want to put in the chat, I'm going to launch a poll. Let's see if my tech brain can do that this morning. Okay, polls. Okay, so I am curious, in your organization, is quality improvement incorporated into all clinical staff job descriptions, non-clinical job descriptions, project committee charters, roles and responsibilities for board members? Please select all that apply. And while the poll is going, feel free to share in the chat about how you have incorporated this. Do you have standard language that sets standard expectations? And is it different for clinical and non-clinical job descriptions? Okay, I have 22 of 50 on the line completing the poll. Keep them coming, thank you. Okay. I'm going to go ahead and end the poll and let's see what we have here. So our results, those under, sorry, lost my train of thought. So we have about 63% of folks on the call have quality improvement in all clinical staff job descriptions. Around half in non-clinical staff job descriptions. I'd love to see those that do have that, how you incorporate that. for us in quality improvement, it's kind of really easy to see where we want to have quality improvement in the job descriptions of all staff and how to write that in, but others might be wanting to do that and needing to look at different ways they can write that in that makes sense. And then a little over half have quality improvement in project and committee charters, and a little under half in roles and responsibilities for board members. And Charlotte shared in the chat that they have job descriptions under the 4 values as related to the CLOPI board. Awesome. Thank you, guys. Criteria 3. Oh, and there's our CWAPI logo. So this is one that is related to CWAPI regulations, right? So it's pretty important, and that is why it's one of the higher performing ones, because we're regulatorily required to do it. But criteria 3 is the organization has processes in place for continuous reporting and monitoring of quality improvement data. And the different ways a hospital can demonstrate meeting this criteria is having a process for continuously monitoring quality data. Their quality data drives identification of quality improvement opportunities. So can you document that when we have a data metric that hits this sort of a point, then we need to start looking at it for quality improvement. Evaluating trends in risk management for data-driven quality improvement efforts. And the facility uses structured prioritization processes to identify frequent and/or high-risk improvement opportunities. There's a variety of prioritization matrices out there where you can take a metric or a goal and rate it based on high risk, high occurrence, chance of mortality, the cost, the hospital priorities, etc. So you can use that prioritization to identify where we want to start working on. So those are the 3 criteria for through systems. Since most of the hospitals meet this, I'm sure you guys are all good, but is there any questions about the culture of continuous improvement through systems? Okay, we are going to go ahead and keep going. And let's talk about the culture of continuous improvement through behaviors. So this means that we want to support QI behaviors in an adaptable organization that embraces innovation, motivation, and accountability. These are really core culture components. Sometimes it's hard to move forward, but we have 84% of the hospitals that completed assessment able to demonstrate that they meet this element, which is fantastic. So if we have these systems in place, the behaviors follow, and then that growth follows after. So the key behaviors that we want to see when we're looking at quality improvement behaviors is the ability to adapt to changes, being accountable, being able to be responsible for your role, acknowledge when something didn't go well. We're not looking at shame and blame, but we're just looking at accountability, what we had involved in that. Embracing innovation, we have to continually innovate to have continuous quality improvement. And then follow through, working through the process and continuing working on those quality improvement initiatives and not just giving up, or when it gets hard, put it to the side. So there are 4 criteria for this element. The first is the organization monitors adherence to best practices, such as evidence-based protocols and order sets in all areas. The organization intentionally develops strong peer relationships with internal and external partners, including those at the local, state, and federal levels. Employees demonstrate initiative to achieve goals and strive for excellence. And managers and leaders regularly evaluate behaviors to ensure they align with organizational values. We're going to spend some time on criteria 3, employees demonstrate initiative to achieve goals and strive for excellence. So um, I'll be asking as a heads up ways that you do this in your hospital because it might be helpful for others to have ideas to start with as well. But let's dig into these. Criteria 1, the organization monitors adherence to best practices such as evidence-based protocols, order sets in all areas. So there are 3 different ways that a hospital can demonstrate meeting this criteria. And now obviously adopting evidence-based protocols and having a monitoring system to make sure that those protocols and workflows are done. One of the really great ways that you can do this is Convergence has developed what we call discovery tools. And that's basically what this shows. It lists these are the evidence-based best practices and protocols and it's a variety of different topics. And then you do a quick chart review to see if those protocols were adhered to, and you can identify areas for improvement there. So if you're interested, those discovery tools can be found at convergencehealth.org, and they are free for download. So after that shameless plug that is hopefully helpful to all of you, we can also look at that the organization reviews and adapts protocols and workflows based on staff input. So is staff identifying where this protocol doesn't work, maybe in rural health as well, and we need to tweak it so that it works better and is safer for staff and the patient. Criteria 2, the organization intentionally develops strong peer relationships with internal and external partners, including those at the local, state, and federal levels. So our rural communities, the hospital can't function in a silo. I think in everything in a rural community, we have to support and look out for each other, right? And that includes the care continuum of our patients and community members. So having strong relationships with others in the community that are providing healthcare services so that everyone kind of knows what's going on and can work together to help patients is really impactful. So we want to look at, do we have strong peer relationships with nearby hospitals that we might be referring patients to? I know in Montana, we have some really small critical access hospitals, and oftentimes they need partnerships with maybe the other critical access hospitals that are a little larger and have a little more service lines that they can transfer patients to and work together to provide patient care as close to home as possible. And also relationships with clinics, long-term care facilities, the public health in the area, and any other community-based organizations. And I'll put a plug in this criteria. It's really good to start developing these. On the assessment, 100% of our hospitals that took the assessment meet this criteria. And when we start looking at social drivers of health and health equity, these relationships are also very important because working together, we can help impact any barriers that community members face outside of the hospital walls that might be within the walls of another organization. So the third criteria is that employees can demonstrate initiative to achieve goals and strive for excellence. And here we have our QAPI logo again. This is really the behavior piece, right? Like, we have individual employee behaviors. So we want to build a culture where staff across the organization can identify that they are responsible for and committed to quality improvement. As I've said before, quality improvement is just not the role of the quality coordinator, and it's just not the role of healthcare providers and direct patient care staff. Everybody in the facility has a role in quality improvement. We have dietary. They have making sure patients get the required, like the meals that are on their diet plan, that they have the right nutrients, that they're getting it at the right times. Our housekeeping and facilities, we want to make sure that things are clean and they're safe for patients. So everybody has a piece in quality improvement, and that is reflected in QAPI plans. We want to build it so that all staff can verbally describe at least one active improvement project or priority. With your QAPI plan, every department or service line needs to have a quality improvement metric and project that they're working on. And so all staff has at least one they should have to identify there. And all staff can explain one quality measure and or communicate where to find the quality measured data. We want to have that holistic understanding in the whole hospital that these are common goals of everybody, of our organization, not just one person. So staff having the opportunity to learn and understand that, and keep bringing that back to center as our common goal. Criteria 4, managers and leaders regularly evaluate behaviors to ensure they align with organizational values. So this criteria can be met via 4 different ways. In the employee annual review process, is there an assessment and expectations for QI within the job descriptions and the review process? Like, are we talking about when an employee has their annual review, are we talking about their understanding and their involvement and their initiative for quality improvement? The organization can also conduct a staff assessment. And this can include questions like about aligning behaviors with values. And it's utilized to gather information to inform improvement efforts so that the hospital can see maybe where we need to provide more support to our staff to increase the understanding of quality improvement and their role in quality improvement. And also encouraging staff to use internal reporting processes to recognize errors or near misses. This is really important. Again, we don't want a shame and blame culture. We want that culture where our staff can speak up and say, I think we need to stop for a second and look at and just double check this so that we don't have an error, and not be penalized for it and not be judged for it and not be scrutinized, but have others be appreciative of that. And that's a hard one to get to. It takes a lot of trust and a lot of culture and organizational growth, but we can get there. So do we have any questions on a culture of continuous improvement through behaviors? Okay, in 2 weeks, we won't be meeting next week, but in 2 weeks, it's one of my favorite topics. We are going to talk about integrating equity into quality practices and engaging patients, partners, and the community. We have a ton of resources, and we'll have our partners at PFCC partners on the call with us to help make really actionable ideas for your hospital to move forward in these areas. When we send out the slides, there will be a lot of resources that you can link to. And so I just wanted to give you a quick view of those. We have some lean, just culture, as well as information on job descriptions for QAPI and patient safety culture. And if you need additional resources on QAPI, we have some of those listed here as well. So I'll give one last chance for questions, but I'll also invite you to reach out at any time. My email address is jwagner@convergencehealth.org, and in the slides there is a link for more information on these, on the quality infrastructure elements. Great. Well, if there's no questions, you're so very welcome, Heather. Thank you guys so much for joining us today. I hope it's a beautiful spring day wherever you are, and have an amazing day. We're almost to the end of the week. So thank you for your time, and we will talk soon.